In this comprehensive presentation, we'll delve into the world of antidepressant medications, exploring their nuances and shedding light on essential aspects. Antidepressants aim to elevate the levels of crucial neurotransmitters like serotonin, norepinephrine, and dopamine within the brain synapses. Throughout our discussion, we'll dissect various classes of antidepressants, unravel their mechanisms of action, and underscore notable side effects vital for understanding in clinical practice. Let's embark on this enlightening journey into the realm of antidepressant pharmacotherapy. In our exploration of antidepressants, we start with selective serotonin reuptake inhibitors, SSRIs. Citalopram acts by inhibiting the serotonin transporter, SERT, thus augmenting serotonergic neurotransmission. However, it may induce sedation due to its antihistamine properties alongside sexual dysfunction and gastrointestinal disturbances like nausea, vomiting, or diarrhea. Escitalopram, another SSRI, shares a mechanism akin to citalopram, effectively blocking CRT and proving effective in general anxiety disorder, GAD. Although it boasts a lower incidence of sexual side effects compared to other SSRIs, it may still precipitate gastrointestinal symptoms. Fluoxetine, renowned for its efficacy in treating obsessive-compulsive disorder, OCD, panic disorder, and eating disorders, operates similarly by impeding SERT. Despite its broad utility, it may trigger sexual dysfunction and gastrointestinal discomfort. Continuing our examination of SSRIs, we delve into additional medications within this class. Fluvoxamine, while bolstering serotonin levels through SERT inhibition, is particularly beneficial in treating OCD and social anxiety. However, its antihistamine properties often lead to sedation alongside sexual dysfunction and gastrointestinal disturbances. Paroxetine, another notable SSRI, is effective across a spectrum of disorders including PTSD, panic disorder, OCD, GAD, and social anxiety. Despite its therapeutic versatility, its antihistamine properties frequently induce sedation, weight gain, and similar side effects like sexual dysfunction and gastrointestinal issues. Lastly, sertraline, known for its efficacy in PTSD, panic disorder, OCD, and social anxiety, operates through SERT inhibition. Nonetheless, it too may cause sexual dysfunction and gastrointestinal discomfort. Moving on to serotonin norepinephrine reuptake inhibitors, SNRIs, let's first explore duloxetine. By impeding both serotonin and norepinephrine transporters, SERT and NET, duloxetine heightens levels of both neurotransmitters, thus augmenting serotonergic and noradrenergic neurotransmission. Its therapeutic efficacy extends to conditions like fibromyalgia, peripheral neuropathy, and GAD. However, potential side effects may encompass sedation, sexual dysfunction, urinary retention, and gastrointestinal disturbances. Next, venlafaxine operates similarly, elevating serotonin and norepinephrine levels by blocking SERT and NET, thereby enhancing both serotonergic and noradrenergic signaling. Its utility extends to treating panic disorder, GAD, and social anxiety. Nonetheless, patients may experience sexual dysfunction and gastrointestinal disturbances as potential adverse effects. In the realm of norepinephrine dopamine reuptake inhibitors, NDRIs, bupropion takes the spotlight. This medication boosts norepinephrine and dopamine levels by thwarting the norepinephrine and dopamine transporters, NET and DAT, thereby amplifying both noradrenergic and dopaminergic neurotransmission. Notably, it also serves as an effective treatment for nicotine addiction and seasonal affective disorder. One distinguishing feature of bupropion is its lack of sexual side effects, rendering it particularly beneficial for patients unresponsive to SSRIs. In the domain of atypical antidepressants, two notable medications stand out, mirtazapine and trazodone, Mirtazapine achieves its therapeutic effects by enhancing noradrenergic and serotonergic neurotransmission through targeted receptor blockade. However, its usage often accompanies sedation and weight gain owing to its antihistamine properties, albeit with fewer sexual side effects than other antidepressants. On the other hand, trazodone augments serotonergic neurotransmission by receptor blockade and enhances serotonin levels by inhibiting the serotonin transporter, SNRI. Notably, it tends to induce sedation due to its antihistamine properties and carries the risk of priapism, though this is a relatively uncommon side effect. Monoamine oxidase inhibitors, MAOIs, constitute a class of antidepressants that includes phenelzine, selegiline, and tranylcypromine. These medications operate by irreversibly inhibiting monoamine oxidase, the enzyme responsible for metabolizing serotonin, norepinephrine, and dopamine, thereby augmenting neurotransmission of these monoamines. Although MAOIs are efficacious in treating major depressive disorder with atypical features, they come with notable risks. Specifically, they can precipitate hypertensive crisis through interactions with certain foods and drugs. Additionally, common side effects include sedation, weight gain, sexual dysfunction, and gastrointestinal disturbances such as nausea, vomiting, or diarrhea. Tricyclic antidepressants, TCAs, such as amitriptyline, clomipramine, desipramine, doxepin, imipramine, and nortriptyline, function by elevating serotonin and norepinephrine levels through the blockade of serotonin and norepinephrine transporters, SERT and NAT. This mechanism facilitates both serotonergic and noradrenergic neurotransmission. TCAs are also efficacious in managing chronic pain disorders. However, they carry a higher risk of anticholinergic side effects, including sedation, weight gain, sexual dysfunction, and cardiac arrhythmias when compared to newer antidepressants. For enuresis, bedwetting, initial management typically involves conservative measures such as employing moisture alarms or pads, establishing scheduled voiding routines, and reducing caffeine intake. If these lifestyle changes prove ineffective, medication therapy may be warranted. Medications commonly used to treat enuresis include desmopressin, an analog of the antidiuretic hormone that counteracts diuresis, and imipramine, a tricyclic antidepressant that has demonstrated efficacy in addressing this condition. Mood stabilizers, comprising anticonvulsants, minerals, and atypical antipsychotics, play a crucial role in managing conditions characterized by fluctuating mood states such as bipolar disorder, borderline personality disorder, and schizoaffective disorder. These medications aim to stabilize mood and mitigate the oscillations between manic and depressive episodes. Treatment approaches with mood stabilizers are frequently tailored to individual patients to accommodate variations in symptoms and responses to medication. This may involve employing combination therapies or augmentation strategies to optimize therapeutic outcomes. Lithium, although its exact mechanism of action remains elusive, is recognized for its efficacy in managing manic depressive episodes in bipolar disorder and as an augmentation therapy for treatment-resistant depression, TRD. As a result, it continues to be a primary choice among mood stabilizers. However, the use of lithium is accompanied by potential side effects, including acne, sedation, weight gain, and various neurological effects such as confusion, ataxia, and tremor. Additionally, its impact on cardiac and renal function necessitates diligent monitoring of lithium levels, as well as regular assessment of renal and thyroid function to ensure patient safety. Anticonvulsant mood stabilizers such as carbamazepine, valproate, and lamotrigine play crucial roles in managing bipolar disorder. Carbamazepine effectively treats mania, but may lead to sedation, weight gain, and rare yet severe side effects like agranulocytosis, hepatotoxicity, and SIADH. Notably, it can diminish the efficacy of oral contraceptives. Valproate, another anticonvulsant, is effective against mania and as a migraine prophylaxis but can induce sedation, weight gain, hepatotoxicity, and poses a teratogenic risk. It's vital to avoid combining valproate with carbamazepine as it may decrease valproate levels. Lamotrigine, while effective in bipolar disorder's manic phase, carries a risk of lamotrigine-induced rash, albeit infrequent, and rare yet severe complications like Stevens-Johnson syndrome. Atypical antipsychotics like aripiprazole, olanzapine, and quetiapine have found utility as mood stabilizers in bipolar disorder management. Combination therapy involving lithium paired with an anticonvulsant such as valproate or carbamazepine is frequently employed in mood disorder management. Additionally, combining lithium with an atypical antipsychotic like aripiprazole, olanzapine, or quetiapine represents another common approach. The choice of specific combination and dosage of mood stabilizers is customized based on individual patient factors including tolerability, treatment response, and clinical needs. Key takeaways: SSRIs such as citalopram, escitalopram, fluoxetine, and sertraline elevate serotonin levels and are widely prescribed for depression and anxiety disorders. SNRIs like duloxetine and venlafaxine boost both serotonin and norepinephrine, offering efficacy in depression, fibromyalgia, and neuropathic pain. Mood stabilizers encompass lithium, anticonvulsants, and atypical antipsychotics, vital for managing mood oscillations in bipolar and schizoaffective disorders.